so excited today to have Tina Aswani Omprakash, and she is somebody who I have met through the Patient Advocacy Network and actually got to meet in person before recording this, which is rare for this podcast. Usually it's people I've never met. So anyway, welcome to the Arthritis Life podcast.
Thank you so much for having me, Cheryl. It's such a pleasure and honor. I'm so glad we got to meet at Healthy Voices this year. I've admired your work for a long time, so thanks for having me on today.
Oh my gosh. No, same right back at you. And I'm like, feel like I should have earlier. I shouldn't should myself, but I really think that it's so important to cover the intersection of inflammatory bowel disease and arthritis. A lot of people don't know that they overlap. So we're going to talk about that. But first, where do you live and what is your relationship to arthritis?
Sounds good. I'm Tina Swani Om Prakash. I live in New York City in Manhattan. And as you said, I have inflammatory bowel disease. I've also had inflammatory arthritis on and off for many years. And I'm excited to talk to you all a little bit about that. I feel like it's a topic we don't talk about enough. So I'm really excited, Cheryl, that you're covering that and bringing light to that because a lot of the community doesn't realize how these different kinds of manifestations are connected to one another.
Yeah, exactly. So without further ado, please feel free to share whatever you would like about your diagnosis story slash saga for Crohn's and then how that led to inflammatory arthritis.
So I have a really long Crohn's journey that's quite windy and like convoluted. So I will spare the community. I've talked about it plenty. But I will share that, it's been a really, really rough journey. And I think what I noticed since childhood is that I've had arthritis. I've had knee pain, ankle pain. And it was sort of dismissed as, oh, she's just growing. I've even had wrist pain and finger pain, like small joint pain. And it's always been dismissed as she's growing, going through puberty and whatnot as 8, 9, 10, 11, 12 years old. And I just feel like it was so much more than that. I know it was because concurrently I was having like eye symptoms, which are also connected to IBD. And I was having derm manifestations too, which are also connected to IBD as well, like skin lesions and stuff. So I know there was something brewing. I wasn't actually diagnosed till I was 22, and I was diagnosed with ulcerative colitis, which was actually Crohn's disease. So ulcerative colitis hits in your colon and rectum, whereas Crohn's disease is from your mouth to your anus. So it's the entire digestive tract. And the little known fact about IBD is just it's not just a bowel disease. It's really, a whole body disease, and it can affect so many aspects of your life and your well-being. I've had over 20 surgeries due to the Crohn's itself. Of course, other surgeries for sinus and dental issues, but that's separate. And I just feel like in my journey, arthritis has been woven in throughout and has been quite debilitating, Cheryl. Like what's happened to me is, yes, of course, before my diagnosis, I was having joint pain, and pretty significant joint pain. I wouldn't say it's like, it's just like, a little bit of an ankle ache or a little bit of a knee ache. It was like hard to get out of bed. So it only got worse as my Crohn's journey progressed when I got a diagnosis. I think when my disease started to worsen, every single time I would flare, it would be preceded by really bad ankle pain, really bad knee pain, to the point where I had to go and get steroid injections. And I'm sure you're really familiar with this as an arthritis patient leader is just, getting those steroid shots also, puts you at risk for other sort of issues. And so every time I was getting those steroid shots, I was like, gosh, these help, but, am I sacrificing my bone density or something else in the process? So it was really challenging. I did want to share, Cheryl, one of the worst points of my journey was 2014, 2015, and preceding that starting in 2013, I started developing like fistulizing disease, which are these tunnels from your intestine into other parts of your body. So your intestine like breaks through because the inflammation's so severe, and it can cause sepsis.
Oh my
These
gosh.
fistulas were breaking into my lady parts, into my bottom,
Mhm.
causing a lot of leakage, sepsis, all kinds of stuff. Preceding this, that this is like the most severe complication of Crohn's.
Mhm.
Preceding this, what was happening was um, I had the worst joint pain I've ever had in my life. And like from my back to my hips to like sciatica on top of all of this. Of course, sciatica is a little bit different, it's neurological. My ankles, my knees, my elbows, my wrists, even my neck, the back of it, even just to move it like this, I literally could not get out of bed. My mom was taking care of me during this time, and she was taking me for like Ayurvedic massages. Like it was so expensive too. And it would help. It would help for a day or two, and then it would come right back. And I was just like,
Yes.
what is happening to me, doc? Like, what is going on? Why is my whole body feeling like it's just gonna like crack, you know? Like, and I don't mean to make light of this. It was really a horrific time because not only was I dealing with these fistulas and just so many Crohn's symptoms, and I had all these derm skin lesions and stuff like that going on too that were acting up. The arthritis was like disabling on so many levels, and you can't get steroid shots in like every part of your body. Yes, you can take prednisone, but even that wasn't helping.
Mhm.
So what they did is they restarted me on biologics, which I know you use for arthritis as well. And one of the biologics I had anaphylactic shock to. It was so bad.
No.
And like it was just hard to find a treatment for my Crohn's, and then the skin stuff and the joint stuff at the same time. And I found that one of the biologics helped my joint stuff, but my bowel and derm stuff still continued. And then one of the biologics was like just gut specific. So it started to help a little bit in the gut, but didn't do anything for the fistulas and didn't do a thing for the joints and certainly didn't do a thing for like the skin lesions. So it was a very like, I feel like you're just kind of like playing like whack-a-mole, like, okay, which symptoms can we like knock out?
100%. I've used that exact analogy. It relates perfectly, I think. I'm so
Like
sorry.
it's so hard, and I know you get it. And so I just want to emphasize that, like when you're having like even IBD, or when you might have arthritis, or when you might have like some of these skin conditions or just autoimmune conditions in general, often they come with other conditions, and they sort of overlap. And it's not just in your head. It's important for us to make sure we tell our doctors that. And I had to scramble to find a rheumatologist and an orthopedist who could give me those steroid injections and manage some of these rheumatological symptoms. So it's important to coordinate your care in a way that if you're seeing a GI already, you may need to get a room, you may need to get a dermatologist, or if you have arthritis and you're starting to have bowel symptoms, it's important to talk to your doctor about, hey, do I need a GI involved here? So a lot of these things are overlapping. I was even tested for ankylosing spondylitis for the HLA-B whatever
Mhm.
stuff, and just to make sure that wasn't happening because that's also comorbid with
Yeah.
IBD. So it's been a really tough journey, but like I think it's really important to highlight that there's a lot of overlapping diagnoses and symptoms.
Yes, and one thing that is kind of a parallel is that like just like we say with rheumatoid arthritis, it's not just joint pain, it's a whole body systemic issue. Inflammatory bowel disease, like Crohn's, it's not just a GI issue, it's a whole body issue, and it's thought to be autoimmune. And so these, your own immune system is attacking these previously healthy tissues in your gut and everywhere else. And for the audience, I just want to make sure, because we don't talk about GI stuff a ton here. I mean, I have gastroparesis, but no one knows why I have that. It's just kind of random out of nowhere,
I
but
have
maybe,
it too.
yeah, maybe it's related. I don't know. Like I got diagnosed with both in the same year, RA and but mine's very fortunately it's very much like flares and remits. Like it's not constant. Um,
We need
but
to talk about the GP at some point. Let me just
yeah.
get that out there.
Oh yeah, yeah. Well, I just want to get a vagus nerve stimulator at this point because it's like supposedly
Me
works with
too.
both GI motility and RA. I'm like 2 for 1, just like we're talking about. But
There's studies going on, and it's
oh
going on for
totally.
IBD too at the same time for vagus nerve stimulation. So
Yeah,
it's a great point.
very
Gastroparesis is
excited.
definitely linked to all of this. Mine's idiopathic, but
Yeah.
yeah, we can chat about that.
It just means we don't know what it is or why it's there. But
Exactly.
I want to make sure the audience knows IBS, irritable bowel syndrome, is completely different than what we say IBD, irritable bowel disease. IBS is much more mild. That's like when have like some constipation or diarrhea randomly, right?
Mm.
And you might have some reflux, but IBD is, and no one knows why you have it. It's like just syndrome is like kind of you have these symptoms, we don't know why they're there. Whereas with IBD, it is autoimmune. Is that correct? That's my understanding.
Yeah, that's correct. So irritable bowel syndrome, IBS, I do have that as well, like the
Hmm.
constipation kind,
Yeah,
IBS-C.
me too. Yeah.
And it was oh God, I just keep adding the diagnosis on,
No.
right?
Yes.
Um, so I actually think I've had that since childhood. I think that's how my symptoms started was with
Mm,
IBS-C. What they say nowadays, and IBS could be completely like not linked to IBD, but in some patients, like it's overlapping.
mm,
And it could be a spectrum, right? Like even if your IBD is well controlled, your IBS could be freaking out, which is usually the
mm.
case for me. And it's hard to tell between the symptoms. So IBS is a syndrome. I don't want to downplay it. It is debilitating of
Yeah,
its own
yeah,
right.
yeah.
It is something that is often managed with diet,
Mhm.
stress management, but also with medications as well. And, breathing exercises, yoga, lots of different things people do, even pelvic floor physical therapy to help
Mhm.
manage it. I do a lot of this stuff too to help manage mine. IBD, inflammatory bowel disease, is immune mediated, just like you were saying, Cheryl. So it's considered an autoimmune condition where your own body is sort of attacking the gut, and along with the gut, it's often attacking other things like the joints and your skin, so and your eyes and a whole bunch of other stuff that could be going on. And in my case, I have like oral health problems because of it too. And I have Sjorgen's too, which affects my oral health. But IBD, it's an autoimmune condition, and it's usually like something that comes with a lot of pain, a lot of abdominal cramping, bloody stools. Not for everyone. Sometimes people can have pretty bad abdominal cramping, but if their disease is higher up in the intestine, they may not see the blood. But if you are seeing fresh blood, it's usually from the rectum or from the bottom of the colon. So there is that, and there's two forms of IBD, and they're considered kind of like a spectrum now. One's ulcerative colitis. As I was explaining, that generally affects the colon, which is the large intestine, and the rectum. And then there's Crohn's disease, which affects you from your mouth to your bottom. And there could be inflammation, like even mouth sores, and bleeding mouth sores. I've had all of that, and all the way down to your bottom, you could have sores. And those sores are usually ulcers, and they can bleed. And sometimes those ulcers get so bad that the intestine starts to narrow. That's called a stricture. Strictures are part of Crohn's disease. And sometimes you can develop called a fistula, as I was also describing. Those are like if you get such bad inflammation, the intestine breaks and causes a tunnel into another organ or out onto your skin or into your private parts. It's really, for lack of a better phrase, a kind of nasty disease. And I
Mhm.
don't think there's a lot of awareness or understanding. And Cheryl, you're 100% right. People often confuse IBD for IBS.
Mm.
And I hear it all the time. And, I think both parties, IBS patients get upset when it's called IBD, and IBD patients get upset when it's called IBS.
Mm.
Because it's like they're similar, but they're so different at the same time. And,
Yeah.
you know, I'll tell you, the other day, my physical therapist was telling me, and I go for pelvic floor PT for a variety of reasons, but and also for my Crohn's, all the surgeries I've had, and just
Yeah.
how messed up my bowel is. And she was telling me, she's like, I don't think people realize how debilitating Crohn's disease is. It's just,
No.
she's like, it's up there with RA, with MS.
I mean,
Um,
yeah.
yeah, it's up there. And I think they're often thinking it's IBS, and
Yeah.
that this can be controlled with diet and lifestyle and some mild medications. But we need some big gun medications. And it's a really hard thing to accept when you think that you can fix this with diet and cutting back stress and all of that.
Yeah, 100%. And I'm a very visual person, so I'm gonna put in the show notes. I made a couple of charts that are kind of an amalgamation of other charts out there to explain. This one's called Types of Rheumatic Diseases, which are diseases that affect the joints, tendons,
Yeah.
muscles, ligaments, and nerve bones. And so according to my sources in making these like CDC and Creaky Joints and other Johns Hopkins medicine, um, the kind of arthritis that can come from IBD, Crohn's, and ulcerative colitis is called enteropathic arthritis, which I had never even, I mean, I've been doing this work for a long time and I hadn't even heard of that phrase until I was like making my course, my Room to Thrive course, and it falls under the spondyloarthritis
Yeah.
umbrella. But I just think it's really important for people because most people who listen to this podcast have like an inflammatory arthritis, usually like RA, psoriatic arthritis, or like axial spondyloarthritis. But to know that that you're more at risk of having IBD if you have an inflammatory arthritis, and it can go the other way, right? Where you have like in your case,
Exactly.
yeah, yeah,
Exactly. It can go either way. You can be diagnosed with one and then years later be diagnosed with the other. And like same goes for like someone with RA. You can be diagnosed with RA and then be diagnosed with IBD many years later.
yeah,
So it happens all the time. And I also want to say sacroiliitis, that inflammation of that the your back, your lower back joints, is very, very common in IBD. And oftentimes, they want to rule out ankylosing spondylitis because of that as well, which I know
yeah.
is, sort of a related autoimmune condition as well.
Yeah. Yeah. And one of the things that I think is so powerful about your work is that you've done so many things. We could spend like hours talking about them. But one thing I wanted to talk about today with our precious time is South Asian representation in chronic
Mhm.
illness communities and particularly GI. Because there's so much
Yeah.
stigma in most cultures. There's kind of like, right, like I think like poop jokes are kind of documented across
Yeah.
cultures, or there's like weird feelings about the GI activities. And then, anyway, I'll hand the mic to you to share a little bit about why you think it's important to have
Yeah.
South Asian representation.
I think that's such a great question, Cheryl, and thank you for recognizing that. So, I'm one of the co-founders of South Asian IBD Alliance, SAIA, we call it for short, SAIA. And I think this is so important to recognize how stigmatized and almost traumatic it is to receive a GI diagnosis, especially one as stigmatized as inflammatory bowel disease. One, it's often equated with IBS, like I was saying. And because it's equated with IBS, it's automatically, this is your fault. You didn't manage your stress well. You ate garbage. You probably drank too much. And you did this to yourself. For IBS patients, that's not a fair assessment to be making, certainly not for IBD patients. And I was unfortunately a victim of that, and I dealt with that. And it is a lot of shame, blame, and guilt to take on. And it's this internalized stigma that then develops like, oh my God, I did this to myself. Oh my God, I should not talk about this. This is disgusting and it's foul and it's gross and blah, blah. I can go on and on. And so I went through this and I didn't really know too many people with this condition at the time. I knew my father had it, but my father died when I was 8 years old, and he was only 39 at the time, and he died
Oh,
from Crohn's that turned into
sorry.
colorectal cancer. Yeah, it's
Oh
really,
my gosh, I'm so sorry.
and he never talked about it, like never, like literally saw him lose like 80, 100 pounds, lose all the hair on his head with chemotherapy. It was awful. It's an awful thing for a child to see. And I think my sister and I both knew that we're probably going to have IBD at some point, but you don't know until you actually get it how bad it is. And so I saw the shame and blame and guilt that he lived with, and suddenly now I had it. I've seen my sister live with it. I've seen aunts and cousins live with it. And nobody talks about it, even till this day. They're just like, what are you doing, Tina? Like, how can you talk about this? It's so gross.
Yeah.
And I'm like, I don't know any other way to not only cope, but to help other people. If I'm going to go through this, I need to know that I can do a service to the community too. So that's really the reason why I started my Own Your Crohn's blog, and the reason why SAIA also came about is because other patients were relating heavily to what I was talking about, and not just other like patients in the South Asian community. I will tell you, like when I first started my blog, Own Your Crohn's, it was Africans in Africa, as well as African Americans, South Americans, and Mexicans, like people all over Latin America, as well as folks in East Asia and the Middle East. Um, I didn't feel comfortable speaking for multiple communities of color, even though we share many stigmas across communities. Some of them can be a little bit different. The Asian and Middle Eastern stigmas are very, very similar. So we are within SAIA, we are getting a lot of outreach from the East Asian, Southeast Asian, Middle Eastern populations because it's very similar about maintaining your family's respect, not disgracing your family in the process of revealing a weakness, such as having, a chronic illness, and that too at a young age. So that's the other point that I wanted to sort of emphasize is, yes, this is very much an IBD, a GI problem, but it's broader than that. I think South Asians as a whole have accepted more common conditions like diabetes and hypertension and heart disease because they're pretty common in our community. But what has not been readily accepted is autoimmune conditions. They hit young, they can even hit when we're kids, right? As pediatric patients, like RA, like AS, like IBD, like MS. And I think that there needs to be a lot more work done in our community more broadly for the Asian, Middle Eastern communities because we're 60% of the world's population. I'm going to be really honest. The South Asian diaspora is 25%. 25%.
Wow.
Yeah, I know we're the largest
Wow.
diaspora in the world.
Yeah.
So, I just want to emphasize that oftentimes, like we're talking about clinical trials, we're talking about underrepresentation, but what we're not talking about is there is this huge chunk of the world that's being left out of a
Yes.
lot of trials. And the reason why we don't go into trials is not even understood. Like there is,
Mhm.
Cheryl, and I do need to emphasize this point, there is a history of colonization of Asian and Middle Eastern countries, whether it dates back to the British Empire or other empires, and there's a lot of mistrust towards Western therapies. And by
Yes.
Western therapies, I mean modern medicine and
Yeah.
surgery.
I
And
just saw a post that was saying, even, sorry, just
no,
throwing
no,
this out there in
no,
case it resonates, that they're like, we need to stop saying Western therapies because it's really modern medicine because modern medicine has been informed by many other cultures, not just Western
no, we
Europe. And
definitely
yeah,
need to
yeah,
change that mindset. I don't
yeah,
disagree at all. And a lot of times they'll label it Eastern therapies like Ayurveda or like Chinese medicine or
Hmm.
naturopathy, things like that. But you're 100% right. It's really modern medicine. And I think it's associated with the West, and that's
Yeah, that's why.
associated
Yeah.
with distrust. And the more we call
Hmm.
it Western medicine, the more those divisions are there and that distrust is there. So
Yeah.
it is a really, really important point that you're making. And I think the stigmas that we're talking about are not just towards the bowel disease or the nature of the disease. Even mental illness falls into this, right? Mental health and mental illness are extremely stigmatized in many communities of color. And it's like, oh, no, 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 no. That's not a brown or black problem.
Yeah. Yeah.
That's often what we hear. And so we don't seek that kind of care. And often with these chronic illnesses, we do need mental health care too. This is a
Hmm.
lot, it's a massive burden for us to take on and carry as patients and our families too.
Hmm.
So a lot of these things are stigmatized, but the other thing that's really stigmatized is the use of modern medicine, modern surgery to manage these conditions. It's almost like it's a failure on your part that you couldn't get this under control using alternative therapies or complementary
Yes.
therapies. And that's the other thing that's stigmatized in a lot of our communities.
Yeah. Oh, 100%. And I was just gonna say that I don't know if have you talked to Sukjin Kaur? She is like chronically brown. I had her on the podcast a while ago. I'm looking at 2021, and she really blew my mind as well on this. And so I'm just
Oh yeah, yeah, she
echoing.
and I are friends.
Yeah, I was gonna say it's not a very big, I'm sure, like you're doing a lot, but it's a small world, and hers
It's a
is
really small world,
chronically,
and
yeah.
there's also Trishna Baradia, who I can put you
Yes.
in touch with if you'd want
Oh,
to talk
good.
with her. She's in the
Yeah.
UK as well, and she works with the Asian MS Society.
Oh, that's so, it's just so, I don't know, I'm just like, yes, I want to amplify your work because this is so important. And I mean, I've been so like blab all my thoughts into the universe in the past. And I know there's been times when I've tried to help reduce the stigma around using Western medicine or modern medicine. And I've probably done so in a way that wasn't like someone pointed out to me gently once that they were like, you should be a little mindful about how you talk about um, like people saying just try yoga or try these supplements because that could be culturally motivated. And I was like, oh my God, hello. Like I have an anthropology minor, but like I did not, you know what I mean? Brain
Yeah,
like we
it's
have we
really a
have
thing.
blind spots. So did you have a hard time trying yourself, like trying Western, I mean, I have to get in the new habit, modern
No, 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 I
medicine?
do it too. I
Yeah.
mean, that's just what we know, right? So it's
Yeah.
something we're gonna all have to work on.
Yeah, yeah. Did you have a evolution towards taking like in your own journey, treatment? So then you mentioned you did Ayurvedic medicine, and then
Mhm.
how did that go in your journey?
I I hate to use the word disastrous.
It's appropriate sometimes.
It is appropriate sometimes. And some people will come after me for that, and it is what it is. But I'm not gonna lie, like my family was very much against modern medicine. They were really scared of the side effects, and that's usually what is the case, is the fear of the side effects overtakes the understanding of how much quality of life you can get from being on that medication, and that maybe those side effects will never happen. Just putting that out there.
I know. I'm like, I really think we need to communicate to people. Side effects are just a possibility. They're not
Yeah.
a guarantee. I mean, I have so many medicines that I don't have any side effects on. Anyway, so yes. Yeah.
Exactly, 100%. So, biologics, really scary for a lot of people, including our community. And the first thing my mom said and my grandparents said when I was asked to be put on a biologic when I was 24 is, oh, no, 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 no. We have to retry all the other forms of complementary and alternative therapies out there. And I'm like, no, I've lost so much weight. I can't do this anymore. And it got to the point of me trying a lot of these therapies because families are crucial. They're integral to our care. We talk about shared decision making in appointments. There's no shared decision making in our Asian cultures without our families. Yes, there might be exceptions to that rule. I don't want to speak for everyone, but if I'm 24 years old and I'm not taking my mother to my appointment, or a family member or many family members to my appointments, it's almost like, why is your family not involved in this? Your family's supposed to guide on this. So
Right.
my family and my doctor need to see eye to eye too. And that was not happening. And that's why I've labeled it disastrous, because it was a constant tug of war. Do I listen to my doctor or do I listen to my elders? And it's not a good place to be in as a patient when you're just trying to get better. So I did try a lot of different forms of complementary and alternative therapies. I do have respect for some of these forms. I do use some, like, for my arthritis and stuff, I use a lot of different oils and things like that now. I go for acupuncture, but, I look at complementary and alternative therapies as adjunctive therapies, as secondary. And I don't take any pills or supplements without my doctor reviewing the ingredients or without my doctor suggesting those supplements or vitamins or whatever. I don't take anything like that, put anything into my body unless my doctor's looked at it. If it's topicals, okay, fine, but I really feel like there is a secondary role for these kinds of things. And that I feel like for immune mediated conditions like ours, Cheryl, a lot of times we do need medication, and it is an acceptance process in communities color. Oftentimes these medications are so stigmatized, and the use of them, and even surgery. Wait till I talk to you about ostomy surgery. God, it's
Mm.
just like it's an acceptance journey to realize you need something like this.
Mm.
And that does bring me to ostomy surgery is, Cheryl, like
Oh, can
when,
you tell them what an ostomy is really
yeah,
quick?
yeah,
Sorry. Okay. Oh,
yeah,
good. Okay. I
just
just want
getting
to
to
make sure.
it. Like when I finally did get on the biologics, we tried really hard, shortened the dosing, doubled the dosing, didn't work. It was too late. And that's the other thing I want to emphasize is oftentimes you can stop the progression of these diseases if you start the therapies early enough. But if you delay and if you wait, which oftentimes the acceptance process results in, the disease can get worse. And that's what happened to me. And I ended up in surgery. But again, it was emergency surgery because for 6 to 8 weeks, my family was like, no, you cannot go for surgery. What was the surgery? It was removing my colon and most of my rectum and giving me a bag on the outside. So small portion of my small intestine was brought to my abdomen and a bag was put over it. So a pouch was put over it externally. And my family was up in arms, Cheryl. They were like, how could you do this? You're 24 years old. Who's going to marry you? This is such a disgrace. It's so foul, smelly, disgusting. By the way, it's not foul, smelly, or disgusting.
Right.
It's perfectly fine. There are some beautiful models out there who are modeling it. I'm not really, out of respect for my family and in-laws and husband, I don't model my ostomy bag, but, I will wear a sari, or I will show that you can live a life with an ostomy bag. An ostomy bag can give you your life back. It is a different way of pooping. It's a different way of going to the bathroom. You don't have pain through your bottom anymore. You're not bleeding through your bottom anymore. And I do have an ostomy bag. I tried to reverse it to get married. My family was like, you need to reverse this thing. I tried doing it, nothing worked. So it's just one of those things, again, to get to the acceptance process. What do we go through in that process to only end up back in that same spot? So that's like been my journey, is just accept some of these things up front. For me, if I had accepted modern medicine, modern surgery early on, I feel like my outcomes would have been completely different. I don't know if I would have had this many surgeries.
Yeah, I mean, and I think your story is very important, and we'll never know, right? Like, and
We'll
there are
never know.
people with our rheumatoid arthritis, they call it difficult to treat RA. It's anywhere from 5 to 20% of people do have kind of treatment resistant
Yep.
disease that even when you hit it with all the meds, like I have a couple friends, it's just such really, they're in such a hard place. They're on medicine number 9 in like 2 years, and you're just like, oh man,
Mm.
like I have treatment what was the opposite of resistant? Treatment happiness of, but mine, they eventually wear off. I'm on biologic number 6 in 22 years, but I
Mm.
am a testament to like the typical experience of somebody whose body does respond to the medicines, which again in rheumatoid arthritis is like about 80 to 95%. And I went
Mhm.
into remission quickly, but I didn't have these cultural barriers. And, ultimately it is your own body. For whatever reason, you can decide what you put in and out. It's just a matter of being informed fully as to that decision. And it's just, thank you again for sharing. And I think that I've learned so much about ostomies and how people thrive with ostomies I learned about them in occupational therapy school briefly, but then on social media, there's been such a great work on destigmatizing them there.
Yeah, no, and I will say just about ostomies in general, I think we're often afraid of what we don't know or understand. And I think
Mm-hmm.
that's why awareness and education is so important to know, look, this isn't that bad. I was tagged in a UK group yesterday, and they tagged me because it was a young South Asian man saying he's tried all the medications and his family's really against the ostomy. And I'm like, okay, this is my fourth ostomy. I've tried to reverse them God knows how many times, and it's not worked out well. And I can tell you, I can assure you that there was a time I was begging my doctor for the ostomy back because I was so sick. And
Mm-hmm.
because the ostomy allows me to eat again, it allows me to go out again, go to the movies, go out to dinners, travel all over the world. It is truly a lifesaver. And I think it's really important to educate yourself and recognize this is a treatment option too, and that you can often get a lot of life back. And it really saved my life. Like at 24 years old, I was 85 pounds. Um,
Oh my
I
gosh.
know, I know. And my normal is like 135, 140. So that tells you like, and I gained it all back, and it took time for my Crohn's to come under control, and then I gained it all back. But it's just, it's amazing how far modern medicine, modern surgery has come. And I think it's important not to look at it as the enemy, but to look at it as something that can help us, that can be a tool in us getting better. And I think oftentimes we want to do everything under the sun besides medicine or surgery, for our diseases. And I think it's important to look at what is the gamut that we have available to us. And these are all tools in our toolbox. And, if we want to do complementary alternative therapy on the side, work with our doctors to see, let's optimize the medication, the surgery first, optimize nutrition, optimize our mental health, and then
Yeah.
sort of, if they think it's appropriate, maybe we try that acupuncture and see if it helps. Something
Yeah.
like that. That's what I would recommend to patients.
It's really a both and, not an either or. There's no reason
Mhm.
you can't do them alongside each other. So,
Exactly, exactly. Just be careful and just be mindful of making sure that you're not doing anything that could, interfere with your medications.
yes, 100%. Well, do you have time for one last question?
Sure.
Okay, okay. So this, I mean, you've answered this already kind of in some ways, but one of my favorite questions to end on is, what does it mean to you to live a good life and thrive with IBD and inflammatory arthritis?
Such a good question, Cheryl.
Yeah.
I think being able to live my life again, have quality of life again, means the world to me. To own my Crohn's, the name of my blog, Own Your Crohn's,
Mhm.
uh, is really how I live my life. And I want to make sure that I continue to empower other people to see the other side of this disease. There is a light at the end of the tunnel. Yes, I know not everybody achieves remission, but you can get to a point where you can live a better life and live the kind of life you want to live, a more meaningful, purposeful life, that you want to live. And it's hard to see that, but that's what gives me joy every day, to make sure that I can do that for myself and that I can make sure I can help others do that for themselves too.
That that's beautiful. You're such a pro. Well, thank you so, so much. You really have turned so much of your own pain into such a beautiful mission. And I'm such a huge fan of all your work. So I'm very glad that we were able to talk today. I know you're in pain right now, and it's just people can't, it's just so hard for people to imagine like how much people go through. So I appreciate you so much, and we will hope everyone, all her links will be in the show notes. So make sure to go check out Tina's work and follow South Asian IBD Alliance and Own Your Crohn's. All right. Thanks so
Thank
much.
you,
Bye bye
Cheryl.
for
Thanks,
now.
everyone.
Bye.